Great. Thanks so much for having me. So my name is Karis. I'm the Vice President of Health and Community Impact. I have a few slides for you here today. I'm going to talk a little bit about what a community information exchange is, what we're doing in San Diego, and kind of how this is trending across the nation around how we're thinking about kind of convening the community governance element, as well as the technical infrastructure needed to do a lot of the system change work. Many of the people earlier have always already highlighted. So if you go to the next slide, I'll talk a little bit about 211 San Diego. You might know what that is. It's a 3-digit dialing code. It's a nonprofit organization that is essentially a public utility that helps people access health, community, and social service resources. They're often known for a resource database. They're often part of United Ways, or they're separate 501c3s. So that's who I am as a nonprofit organization and in my role within San Diego. But again, this is a 3-digit dialing code that's available across the nation. And then a community information exchange, we steward, what we call steward our community information exchange. We operate similar to a collective impact like role, where we're a backbone organization for this larger kind of systems change work. And the goal of the CIE is really moving towards person-centered care interventions. That's kind of breaking down silos around data sharing, but the goal is really for people to provide more trauma-informed care or more holistic service care. That's really the goal of what the CIE is. So if you go to the next slide, I think we have a definition of what it is. Yes, CIE is a trademark term, not because we're trying to profit off of it. It's not a technology infrastructure, but because there's a lot of technology investment in this space, we're trying to separate ourselves to say that there's a need for local community-led ecosystem infrastructures that support multi-service network partners. I think many of the colleagues really articulated it earlier with the images of being able to show how many different organizations have to work together for successful coordination that's using an aligned or shared language, a resource database, integrated technology platforms. We really focus on interoperability and the ability to not have to use one data system, but the ability to connect with multiple data systems, and then with the goal of really providing more comprehensive community care planning, that people are working off shared care plans and collaborating more efficiently coordinated to serve people in a more proactive, holistic, equitable way. So on the right-hand side, you can kind of see what that image looks like, but we don't need to go into that. You can have these in the slides. So if you go to the next slide, we started actually 10 years ago in San Diego when we were trying to address a significant amount of homeless individuals in downtown San Diego, people experiencing homelessness. They were being transported from the shelter to the hospital to jail. And so a bunch of providers were like, hey, what if we started sharing information, asking individuals if they were okay with consenting to have their information shared, and we could start coordinating our services a little bit more cohesively, because this wasn't really working. And so it really started as a data sharing infrastructure between health and social services. And it's since expanded over the 10 years to be able to kind of be something much larger. And so we really think of ourselves as a local data intermediary. We're a technical infrastructure, but also this shared governance infrastructure that allows for information and coordination to be shared that's really centered around that individual. So if you see on the right-hand side, a CIE is meant to think about things from a micro, meso, macro standpoint. So from what the individual needs, what's their experience like, what are their strengths, opportunities to really provide more coordinated care on behalf of them. How can agencies work more collaboratively together across different sectors so that it's more efficient and coordinated and responsive to those needs? And then from a macro standpoint, if we have access to that data, how are we more responsive to the inequities and the unmet needs and the disparities we're seeing within our community? So you can see here some of the different organizations and the data that's populated in, but again, individuals consent in, have their information shared, and we have access to a longitudinal client record with role-based permissions and a bunch of legal elements that many of you can imagine that's available. But really the idea is to use that shared care plan. It's a blended grading funding model. And so that's really how it's funded. And I know I have about 30 seconds left because I'm good at my timer. So if you go to the last slide, we'll talk a little bit about what are the facilitators for success. The local stewardship and shared community-led governance is a huge thing, to be able to have it defined and aligned with the community-based organizations and the community members that are having their information shared. We leverage our local infrastructure, existing relationships, initiatives, services. We didn't try to recreate the wheel, but really building off the trust and capacity within our community, because everything really does align with local. And then the idea that this requires an evolution agile process to the work. Barriers, I already kind of highlighted some. There's a significant investment on the technology versus the local infrastructure. And so we see that in healthcare, there is that, that there's local governments and there's local healthcare organizations. For some reason, social services don't get that same love. So we're really about understanding that local infrastructure for community-based organizations is even more complicated than some of the standards that have been created around healthcare. So being able to kind of think about what local needs are. Measurement evaluation is always challenging just because ROI is not, is hard to prove, and there's not necessarily healthcare outcomes. It's more on public good and those kind of things. And because there's kind of this misalignment between perspectives and needs and initiatives and supporting your own population or your own members, your own patients, it doesn't necessarily get to that collective work that CIAs are really pushing towards. And then there's still a lack of interoperability standards, as we've seen across healthcare. It's still a challenge. And then within social services or human services, it continues to be a challenge. So those are some of the lessons learned, emergence practices of what we've seen so far, but happy to discuss more. And I know we'll kick it to Paul for his insights too. To work with.
Thank